Hello guys, welcome to Dr. Science. So today we are going to talk about parathyroid hormone. So in this video I will be mainly talking about parathyroid hormone. In my part 2 I will be talking about vitamin D because both these things work together. Okay, and you have to know what is the difference between the parathyroid hormone and vitamin D in order to understand the clinical features of the patient. Okay, and in my third video I will be mainly talking about what are osteoblasts, osteocytes and osteoclasts. Okay, you should understand how these three work. Okay, because in this thing you will be talking about rank ligand. Okay, this is very important because in certain types of cancers this rank ligand activity is more, so we will give antagonists of the rank ligand, or we simply call it as rank ligand antagonist. Okay, so that is very important to know. So as you can see from the picture here, which is taken from the internal medicine, this thing is very complex to understand. So as you can see, here are the parathyroid glands and they are secreting parathyroid hormone. I will just explain to you guys how the parathyroid hormone is produced, and then we will move into the topic. Okay, I will show the image at last and explain it to you. Okay guys, so let's talk about what is meant by the parathyroid hormone. So parathyroid hormone is a 84 amino acid peptide. Okay, it means, as you can see here, this is the peptide of the parathyroid hormone. So this is the parathyroid hormone and it consists of nearly 84 amino acid. The first amino acid, as you can see, I drew that in red color because the first 30 amino acids are very important. Because why this is important? Because you will be hearing a substance called as a hormone called as parathyroid hormone related peptide. This is seen in certain types of cancers. Okay, and this thing is also similar to parathyroid hormone, but here the thing is it consists of nearly 134 amino acids, and here also the first 30 amino acids are similar to the parathyroid hormone. That's why this can act as a parathyroid hormone. Okay, and there will be increased parathyroid hormone in certain types of cancers. So where this parathyroid hormone is produced? So as you can see here, this is your thyroid gland, and the back of the thyroid gland there are these parathyroid glands. Okay, so at the back of the thyroid gland you can see these four parathyroid glands, and if you take a zoom at these parathyroid glands, so this is the parathyroid gland. In the parathyroid gland you will find certain types of cells, and these cells are called the C cells, which are storing the parathyroid hormone. Okay, so this parathyroid gland, it have certain types of receptors. What are these receptors? These are calcium sensitive, or we can call them as calcium sensing receptors. Okay, sensing receptors, because they sense the calcium in our body. Okay, so once there is decreased calcium in our body, these receptors are activated. Decreased calcium will activate these receptors and the parathyroid hormone is released from these cells. Okay, so how this parathyroid hormone works is the main thing we want to learn. Okay, so parathyroid hormone, which is a 84 amino acid peptide, so this thing mainly acts by three ways. The first one is the bone. The second one is it mainly acts on gastrointestinal tract or on the intestines. And the third one is the parathyroid hormone also works on the kidneys. Okay, So the parathyroid hormone will bring the calcium mainly from these three organs. Okay, so we will learn how the parathyroid hormone will work on the kidneys. So here is the parathyroid hormone. First we will talk about bone, okay, because that is very important. So normally bone, it consists of 2% cells, okay, and 98% it consists of matrix. So here is your bone. So as you can see here, there are only 2% of the cells present in the bone, and most of the thing is matrix present in your bone, or we can simply call this as extracellular matrix because it is present outside the cells, right? So here is a lot of matrix. 98% of the bone consists of this matrix. So I'll just clear this one for you guys. So the cells here we are mainly talking about osteocyte, osteoblast, and the other one is osteoclast. Whereas the 98% matrix is again divided into organic and inorganic compounds. First we will talk about inorganic thing. So in inorganic we will be mainly seeing calcium, phosphate, okay. So these are the main things you have to remember. And in the matrix you will be seeing organic compounds such as, yes, it is type 1 collagen. I will explain it to you what is meant by type 1 collagen. So suppose this is the bone. Bone has this collagen thing. It means it's like a fibrous tissue, okay, and this is called as the collagen, which is the extracellular matrix, okay, and it is mainly type 1. How can you there are different types, okay. Collagen is differentiated into a lot of types: type 1, type 2, type 3, type 4, etc., etc. But on the bone it is type 1. How can you remember this? Bone, the 1 stands for type 1. Type 1 collagen is present in the bone, okay. So in the bone, as we already talked about, there are certain types of cells. Those cells, as you can see here, these cells are called as osteoblasts, and these are very good cells, okay, because they helps in bone formation. Because inside these cells there is a lot of extracellular matrix, lots of extracellular matrix, and we know that bone needs the matrix, right? So that's why osteoblasts are are the ones which help in the bone formation. And there are, and you should take a note, the the most important receptors present on the osteoblasts are the receptors for parathyroid hormone, okay. And not only that, there are receptors for vitamin D. I will explain it to you guys why these receptors are present. But next we will talk about osteoclasts. These are very dangerous and they have these long claws present on it. That's why they are called as osteoclasts. And these osteoclasts, what they will do, they will break the bone, or we will call simply as bone resorption, okay. They help in the bone resorption because with these claws what they will do, they will break the bone with these claws. And when the bone is really I mean the bone is acted upon the osteoclast, they will release calcium and phosphate from the bone. Okay, so these things are osteoclasts. So how this is happening we will see. So here are your osteoblasts, and they have receptor for, yeah, they have receptor for parathyroid hormone. So once the parathyroid hormone is released from the parathyroid glands, it will act on osteoblasts. Okay, once the osteoblasts are activated, what they will do, they will go and kick the butt of the osteoclasts. So here are your osteoclasts. Okay, how this is activated I will explain in part 3. So for a moment you just trust me that they are going to kick the butt of the osteoclasts. As you know, the osteoclasts are having these claws present on it. So what it will do, it will go to the bone. So this is your bone. So as you can see, these are the osteoclasts. They are having these long claws. Okay, so these osteoclasts, they will these are the claws of the osteoclast, and they will break the bone. Okay, and calcium and phosphate is released from the bone. So normally what is happening, the parathyroid hormone is going and binding to the osteoblast, and osteoblast will kick the butt of osteoclasts, and osteoclasts are the one that will break the bone, and during that process calcium and phosphate is coming out of the bone. Okay, so you have to know that normally, suppose this is the bone, inside the bone, so this is the bone, I already told you inside the bone there is, yes, let me draw it well. So inside the bone there is type 1 collagen, right? So I will draw this diagram here. So this is the type 1 collagen. So this type 1 collagen, on its surface they are having certain amino acids. So these are the amino acids. These are hydroxy proline amino acids. Okay, so on these hydroxyproline amino acids, normally the calcium and the phosphate are binding. So we can say these here is the calcium and here is your phosphate. They are binding on this hydroxyproline residue. So once the osteoclast come, so here is your osteoclast, what they will do, they will release hydrogen. Okay, not hydrogen, protons, and these protons are acidic. Okay, so we can say that, we can conclude that acidic nature is the one, acidic nature of the cells will cause breaking of the bone, or we can say bone resorption. Okay, resorption. Whereas alkaline conditions, they will cause bone mineralization. Okay, this thing is very important because you will be hearing an enzyme called as alkaline phosphatase. Okay, which is a marker, it is a marker, this is very important, it is a marker for growth of bone, or we can simply call it as bone mineralization. Okay, this thing is very important. Alkaline phosphatase is a marker for bone mineralization. So we'll come to here again. So this osteoclasts with their claws are breaking this hydroxyproline residues, and together calcium and phosphate is coming out. But normally the thing here is calcium. So this is the calcium and here is the phosphate. When they are coming outside, I mean where they when they are coming outside of the bone, they always love to bind with each other, and we don't want this, because once they bind they will go and settle to the hydroxyproline, and thus again the bone is formed. I mean bone mineralization will occur. We don't want this to happen. That's why what we will do, we will kick out this phosphate. Okay, what we will do, the phosphate is excreted into the urine. That's why parathyroid hormone is also called as the phosphate flashing hormone. Okay, this is a very important thing. Now we will go to the kidneys, how the parathyroid hormone is excreting the phosphate. So we will talk about the kidneys. Okay, in the kidneys what the parathyroid hormone is doing, so this is the nephron. So in this nephron what the parathyroid hormone is doing, so normally you can see here, this is the proximal part of the nephron, or we can simply call it as the proximal convoluted tubule. Normally the calcium and the phosphorus is coming from the bone. Okay, so what, not only that, one of the residue was hydroxyproline also, right? As osteoclasts, they will not only damage the calcium and phosphate, they will damage the collagen type 1 also. So hydroxyproline is coming out. So these three substances are coming here. So what will happen here, the calcium and phosphate is reabsorbed, right? Normally the calcium and the phosphate are reabsorbed here. So what the parathyroid hormone will do, it will, there is a transporter here. Okay, this transporter is called as the sodium calcium co-transporter. It means it will transport both sodium and calcium. Not only that, there are sodium phosphate co-transporters also. Okay, so the calcium and phosphate is getting, parathyroid hormone will block these transporters. So what will happen to the calcium and phosphate, they will go into the urine. But the main thing here is we need calcium. So in the DCT, or the distal convoluted tubule, there are again certain transporter which will absorb the calcium. Okay, but they will not absorb the phosphate. Okay, that's why the phosphate will appear in the urine. Not only phosphate, hydroxyproline are also found in the urine. So we can simply say that parathyroid hormone will increase the calcium in the blood. Okay, in the blood, whereas decrease the phosphate in the blood. So the other thing here is parathyroid hormone will decrease the calcium in the urine and increase the phosphate in the urine. This is very important and you should know these things. So before ending this topic, I would also like to tell that parathyroid hormone will activate vitamin D. This is very important. Okay, in part 2 I will be explaining about vitamin D, why it is important for the parathyroid hormone. Okay, so before ending the topic, let's go to the image. So these are your parathyroid glands. and they consist of calcium sensing receptors. So there is low calcium in the body, they will release the parathyroid hormone, they will act on the bone. Okay, and as you can see here, calcium and phosphate is getting released, and calcium goes into the blood. Okay, so this was about the parathyroid hormone. As I already told you, parathyroid hormone not only acts on the bone, it will also activate the vitamin D3. Okay, vitamin D, it will activate the vitamin D. So that's ends our topic. Thank you.